All right, we'll go ahead and get started. Again, good afternoon. My name is Leanne Foster, and I am a Provider Outreach and Education Specialist here at WPS Government Health Administrators, and I'd like to welcome you to our Provider Enrollment Opt-out webinar. I do have to start out with our disclaimer today. So this disclaimer is just telling you that the material presented during the session today is accurate as of today. If you've worked with Medicare for any period of time, you're well aware that Medicare changes often. So I am going to encourage you to make sure that you're continuing to review official CMS communication, which includes both the CMS and the WPS GHA website, just to make sure you're up to date on the most current CMS rules and regulations. I've prepared the material based off of those regulations, and I'll also be answering questions based on those regulations today. Finally, I do want to just point out that CMS prohibits recording or screenshotting of the presentation today for profit-making purposes. And as I mentioned a few moments ago, we are recording this session today. So there is simply no need. You will have this recording available to you. We will be posting this, barring any technical difficulties, to our WPS GHA website as an encore video, along with our WPS GHA YouTube channel. The differences in those two there, our website is going to look like a YouTube video, but we do have a player embedded on that website, and it will be available on that website for you to view without needing to access YouTube, which I know can be a little bit of a challenge given all of the security protocols that we all interact with on a daily basis. So you'd have that option for 90 days, and that's calendar days. And then Ellen's also put the link to our YouTube channel Encore playlist. The recording will live on that playlist indefinitely, so it'll be available to you if you missed something, you wanted to see it again, or you happen to know somebody who wasn't able to attend today that might find this helpful. So that'll be out there for you, and it'll be out there as soon as possible after today's session. That brings me to our agenda today. So in order to comply with Medicare law, if a provider is treating or providing services to a Medicare patient and they are Medicare covered services, that provider has a few options. They either need to bill Medicare, be opted out of Medicare and entering into a private contract, or they have to furnish the services at no charge. So today we're going to be covering what it means to opt out of Medicare, which is going to include defining what that is, what it means to the provider, and what it means to the beneficiary. We're also going to go through providers that are eligible to opt out. Not every provider is eligible to opt out. It does include a list of physicians and non-physicians, so we'll go through that with you today. We're also going to provide an overview of opt-out, which will include how to opt out, the timeframes. We're going to talk about the opt-out affidavit if you're choosing to opt out, and then we're going to talk about private contract requirements with the beneficiary, again, if you're choosing to opt out. And then along with that, I'm going to provide you with some resources related to opt-out. One thing that we find is we do get a lot of questions where opt-out is getting confused with or with another enrollment action. One that comes up oftentimes is deactivation. Opt-out and deactivation are very different things. We're going to talk through that today. So starting with what is opting out? What does this mean? So as I stated, provider sees a Medicare beneficiary for a Medicare covered service. They have those three options. They're either going to bill Medicare, which is going to mean the provider is going to need to enroll and get a provider transaction access number, or PTAN, in order to bill the Medicare program for that service. That's the most common thing that happens. The other option is that they'd furnish the services at no charge to the beneficiary, or they have opted out of Medicare and they have entered into a private contract with the beneficiary. And it does happen. Most of our providers do bill Medicare, but opt-out is something some providers are electing. So opt-out is our focus for today, and opt-out is outlined in our Program Integrity Manual, Chapter 10. That is the regulation that governs all things provider enrollment. And you're looking at section 10.6.12, and I'm going to take you out there. So I'm going to take you all the way back to the CMS website. My apologies, I'm just a little ahead of where I want it to be. So this is the cms.gov website, and to find our program integrity manual, I always direct people to scroll down their page to the top resources. Manuals, forms, and transmittals are always there, and it's just the quickest way to get there. I'll drop that down and I'll go to internet only manuals because that program integrity manual is one. And then we are looking at 100-8, which is that program integrity manual. From there, you'll go into Chapter 10 for Medicare enrollment. And from here, I can't get you to this section as a link because that's not a web link, but from here, what we can do is we can search for that section that I gave you, which is 10.6.12. And these headings typically tend to be links, depends on your browser settings. But everything we're going to talk about today is outlined here. So if you're wanting to learn a little bit more, if you're wanting to see the actual regulation, I wanted to make sure that you have that, and I've provided that as a link in your material today. So opt-out, it is a decision that the provider makes, and when a provider is choosing to opt out, that decision is going to apply to services that they provide to all of their patients and all of their service locations. One of the things that you are going to hear me say today a couple of times is that opting out is not something you can choose to do at one office and then choose to enroll and bill at another office. You're not normally allowed to have dual status. You're either enrolled in the Medicare program or you're opted out or you're not seeing those Medicare patients, and we don't have any oversight into that. Those are really your options. There is an exception that we will talk about for emergent services, but for normal day-to-day office visits, normal day-to-day services, you are either billing them to Medicare or you have chosen to opt out and you're entering into private contracts. So this option is normally selected when a provider does not wish to enroll or bill the Medicare program. They have this option. They will not bill Medicare. The beneficiary will also not be able to bill Medicare. They've entered into a private contract, and we'll talk about those, but that's what that contract is saying, is it's putting the beneficiary on notice. I'm seeing this provider and I understand that I am not going to be eligible for reimbursement from Medicare. So opt-out means nobody's going to bill Medicare for that service, and that patient is going to pay out of pocket for those services. Now, providers that opt out, they are providers that are otherwise eligible to enroll in the Medicare program. So you must be a Medicare eligible provider to be eligible to opt out. If you're not a provider that is, if you're a provider who is not eligible to bill Medicare directly, opt-out is not an option for you or something that you need to consider or worry about. This is for Medicare eligible providers. If a Medicare eligible provider does opt out, they are going to be eligible to order and refer. If they are ordering or referring for services, they're not billing the services. So if they've entered into a private practice and they're writing up a referral or an order for a service to a provider who is eligible or is intending to bill Medicare, that is acceptable. Opt-out providers still have MPIs. We will still create an opt-out record for them in our provider enrollment chain and ownership system, also known as PACOS. So their NPI, or their National Provider Identifier, is going to be in our system for them to order and refer. So some of these impacts I've talked about, but I do want to just be very clear with these. So as I stated, if a provider is choosing to opt out, it has some pretty broad impacts. It's going to impact all of their patients. They can't opt out for some patients and not others. If you opt out, It's every patient that you see. It's every service that is provided. Again, there's that emergent exception that we'll talk about. It's going to be all provider transaction access numbers, and this includes reassignments. Like I said earlier, provider can't opt out at location A and then actually be enrolled to bill at location B, and that can happen often with a reassignment situation. If you have a provider who is in private practice and they chose to opt out for that private practice, they are choosing to opt out for any of their reassignments as well. And what will happen is if they opt out at the time, and at the time they have active enrollments in our system, those active PTANs, those provider transaction access numbers, are going to be terminated because the provider is now opting out. Now, there's generally some verification that occurs when we're processing those opt-out affidavits that come in, which we'll talk about, but there's some verification and some questions asked. Are you sure you want to opt out? Because we are going to deactivate everything else. So it has some pretty broad implications, and that's something to keep in mind. If a provider opts out of Medicare, they are excluded from Medicare charge limits because, again, they're not billing us. We're not going to have oversight into what they are charging their patients. And so limiting charge, such as, say, with a non-participating provider, is not going to be applied because, again, we have no oversight because those claims are not coming through our system. They're not adjudicating. We don't see those charges. All right, so that brings me to some common misunderstandings, and I've mentioned a couple of them already. The first one is that opt-out is not the same as non-participating. When a provider enrolls in Medicare, if they're in solo practice or they're a group or an organization, they have the option to become what we call a participating provider, which offers them a slightly higher allowable amount. They're agreeing to accept assignment or Medicare payment as payment in full outside of coinsurance, deductible, and non-covered services. If they wish to be a non-participating provider and work within the non-participating limiting charge, which is typically 115%, they simply won't fill out the CMS 460 for participating. Opting out, again, the charges are not going to be billed to Medicare at all, so it is not the same as being non-participating. It's also not the same as a deactivation or a termination. So if a provider is retiring or they're leaving an office, in the past we've actually seen providers that have submitted opt-out affidavits thinking that that's how they deactivate a number. And then they run into implications where they try to enroll at another practice and they're actually opted out. So deactivation and termination, you can request that we end date or terminate your number if a provider is leaving. That's a simple CMS 855 application action and not an opt-out. And as I mentioned, opt-out providers, they cannot be enrolled and be opt-out except for certain emergency services. So if you've run into providers in your interactions that say, well, I'm enrolled and I'm opted out, they're enrolled, but only for emergency services only. Maybe they're staffing an emergency department and they're going to need to bill for those services. That'll be the one exception. So next, we're going to talk about who's eligible to opt out and who is not eligible to opt out. As we go through this, I am going to show you a resource that has this laid out. It is also in that program integrity manual that we just looked at, but there are a lot of resources that are going to help you identify this. So let's start with physicians that are eligible. So MDs, DOs, so those doctors of medicine, doctors of osteopathy, regardless of specialty, they are all eligible to opt out of Medicare if they so choose. Along with that, doctors of dental surgery, so your DDSs, doctors of dental medicine, your DDMs, and your doctors of optometry. Essentially, all of your physicians are going to be eligible or have the option to choose to opt out if they do not wish to bill Medicare for services and want to enter into private contracts where the beneficiaries understand they are forfeiting their Medicare benefits as well. for that service. So for non-physicians, there is quite the list. So I'm going to run through them, but we do have physician assistants, nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists or CRNAs, certified nurse midwives, clinical psychologists, clinical social workers, registered dietitians or MNTs. They can all opt out. This year, starting January 1 of 2024, marriage and family therapists and mental health counselors were added as new mental health specialties to the Medicare program. If they choose, they may opt out. One thing that we saw as these two specialties started to enroll, a lot seems to give us feedback and ask questions about or indications that they either had to enroll or opt out. Now, if you see a Medicare beneficiary, yes, you either have to be enrolled and billed for the service or you have to be opted out and in private contract. But if you're not seeing Medicare patients, and some of these specialties may not, if you're not seeing Medicare patients, you don't have to look at either option unless you anticipate you will be seeing Medicare patients and you need to be prepared for that. So that is something to keep in mind. Nobody is required to opt out of Medicare. It is a choice that is made by the provider, and that's actually another one of those misunderstandings or misconceptions that we run into. Opt-out is not, nobody is required to opt out. If you're not a Medicare eligible specialty, none of this is an option for you anyway, so opt-out's not necessary. Now you'll notice that this is not all specialties. So we're going to take a look at the non-physician specialties that cannot opt out. These are providers that are required to enroll if they're seeing a Medicare patient. They don't have opt-out as an option. So anesthesiology assistants, chiropractors, occupational and physical therapists, audiologists, and speech and language pathologists. Again, opt-out is not an option for these providers. If they see a patient, they do need to enroll, they do need to bill, and will be reimbursed for those services. So as I mentioned, there is a resource, there's a couple of them. First, if you look out in the program integrity manual, it does have a listing of the providers who can opt out, okay? It doesn't have necessarily a list of the providers who cannot opt out, but on our WPSGHA website, and I search, it's usually the easiest way to find things. So I'm just searching for opt-out. And a couple of things come up. Opting out of Medicare enrollment is where I am going to take you at this time. So if you go into that opting out of Medicare enrollment, this is going to give you a lot of links and a lot of the things, there's going to be more information about a lot of the things we talk about today here. This is a really good resource if you're considering opting out, or 6 months down the road you interact with a provider who wants to opt out. Again, opt out, it's not the majority of our providers, so it is something that you might run into a little less frequently, and a resource would be helpful. So the first one is providers eligible to opt out. It is a link, it's a jump link to that page, and it runs through that same list of providers that we're talking about, along with the list of providers that are not eligible to opt out. I'm just going to back up. All right. Now we know who can opt out. Let's talk about the timelines. There are some specific timelines that are actually going to limit certain things about opt-out, and opt-out lasts for a period of time. So let's look at that. So initial opt-out election, it's a little bit different depending upon where that provider is. Are they enrolled? Are they not enrolled? If they're enrolled, are they participating or are they non-participating? So non-participating providers, these are providers that are enrolled but they have not signed a CMS 460. They have not agreed to accept assignment or Medicare payment as payment in full. They do not, they might have a PTAN, but they're not filling out that form. They can opt out anytime simply by filing an affidavit. And we're going to talk about that affidavit, what needs to be included, and we're going to look at a couple of examples of what our template looks like so you can see that. But they can opt out anytime if they're non-participating. They haven't already agreed to be participating. And the reason it's going to be different here is if a provider's agreed to be participating, that is for the entire calendar year. So it runs up until open enrollment, which is at the end of the year, and you can't break that early. So if you have a provider that's participating, we're going to look at that a little bit differently. But back to the non-participating providers, like I said, they can elect to opt out anytime, and the effective date of their opt-out is going to be the date the affidavit is signed. So they may have different effective dates than, say, a participating provider. Participating providers, they can opt out and they can break it, but it's going to be by quarter. Okay. Typically that open enrollment period is when someone will change PAR, but with opt-out, they can break that, but they do need to go by quarter. They do need to send in that affidavit 30 days prior to the quarter where they would like their opt-out to start. And I want to say that again, just for clarity, they need to submit it 30 days prior to the quarter they want their opt-out to start. And the quarters are January 1st, April 1st, July 1st, and October 1st. So if they're wanting to opt out in January, December is where we're going to need that affidavit. April, we're going to need that affidavit submitted in March. For the July quarter, it'll be in June. And for the October quarter, it'll be in September. So, and then their effective date is going to be the start of that quarter, that January, April, July, or October 1st. So even if it processes a few weeks before that quarter, it's not going to kick in until the start date of that quarter. Once that opt-out is in place with their effective date, that opt-out period, it is in place for 2 years. Okay, so they will be opt-out, they will not be billing Medicare, and they'll be entering into private contracts, except for emergency services, for a period of 2 years. We'll talk about terminations next. There are a few options, but for the most part, opt-out is for 2 years. And again, it impacts all of their PTANs, all of their practice locations, and all of their patients. So, cancellation. What if we want to cancel it? One thing is that everything's going to happen in writing. This is not something that you can call customer service and say, hey, I want to end my opt-out. It starts with an signed affidavit, which we'll talk about, but it will need to be a written request to remove it. Okay, that is going to need to be sent to each MAC that the provider bills. So if they're opt-out, they practice in multiple states, they're likely opted out in multiple states, but they need to send them individually. If they're opted out in multiple states, they can't send it to one contractor and have it impact the other contractor. It all stands on its own by contract. They need to send that in 30 days prior to the end of the current opt-out. So they're going to want to know where they stand, and we do have a list for that. So let me show you that. It's actually out on this this opt-out of Medicare page that we were on before, and there is a link to an opt-out list. And I'm going to go ahead and grab that. It's actually taking you out to data.cms.gov, and this is going to be one that we'll need to, I'm going to view the data. You could download it, view the data, and what you'll see out here is that the providers can be are visible, and you can see their opt-out effective date and their opt-out end date and the locations for which they're opt-out. So all of that information is out there on that public website. All right. And again, you want to be sending in that written cancellation 30 days prior to the end of that current opt-out. Now, if that cancellation is sent in, there are certain situations where it is going to be returned. So if it is going to be inside those 30 days, so if it's day 20, that's going to be returned. It has to be 30 days prior. You can send it a little bit before the 30 days prior, but not too far ahead if it's more than 90 days prior to the renewal. So don't send it out in 6 months in advance. We can't do that. So somewhere between that 60 and 30-day mark, if you're sending it in there, that's really going to be that sweet spot. Don't miss that 30 days. It can't be less than 30 days, but it also cannot be more than 90. The other thing is if your opt-out has renewed, and we're going to talk about that in a second, if it's renewed, it can't be canceled at that point. It is binding. So make sure that if you're working with opt-out providers that you are looking at those dates. And the other thing I do want to point out, once a provider has canceled their opt-out, they are then immediately eligible to enroll in Medicare if they're seeing Medicare patients. They are going to have an opt-out affidavit record inside of our PACO system, but it is not going to be necessarily attached to a PTAN, and it is not the type of record that builds anything in our claims processing system to adjudicate claims. So if a provider has canceled and they now want to be able to bill for Medicare services, it's important to note that they are going to have to enroll by filling out a CMS 855I application. And along with that, you'll notice I keep talking about the I and individuals. I should have stated this earlier, but organizations are not eligible to opt out. Opt out is an option for the individual providers and those that are providing those services, not the organizations that oversee them. So renewal, as I stated, opt out, it's 2 years. Renewal of that is automatic. So if we do not hear in the specified timeframes, okay, we are going to renew. Now, we are going to notify you that your auto renewal is coming up. You don't have to just be out on that website looking for it. Each MAC will send out a renewal notice 90 days prior to that renewal date, which is going to allow for that time if the provider chooses to cancel it. It's going to give you those options. It's going to lay that out for you. If we don't hear from you, then it will automatically renew for another 2 years. Okay, where it's just the system's going to keep on going. They're going to adjust that date. You don't need to send in a new affidavit for that renewal. If you're choosing to continue opt-out status, just let it go. You can disregard that renewal letter. You know it's going to happen, and then your end date's going to change for that. So, and you can monitor that on that website. But again, if you want to cancel that, make sure that you're getting that cancellation sent in to us. Early termination, I did mention that. I kept it separate from cancellation because it is a little bit different. Early termination is something that can occur the first time a provider is in an opt-out period. This allows for providers that maybe didn't fully understand opt-out, or maybe their scenario changed initially after they opted out, an option to terminate early without any penalties. So they have 90 days from the effective date of their initial opt-out. This is not something that's available for subsequent opt-out periods. This is just that first one. The part of that, they're going to have to make sure that they're notifying any beneficiaries that they entered into private contracts with, that they are terminating their opt-out status, and that those beneficiaries have the right to begin filing claims once that opt-out status is terminated. So just making sure that they're going to know that they have that option again. And then they're also going to need to refund beneficiaries any funds that were collected in excess of coinsurance and deductible. Because if that early termination happens, it's almost like that opt-out didn't exist. It's not that the opt-out was only there for 90 days. It kind of just goes away, and those 90 days can be billed. So that's the reason for that refund, the reason for that notification. They're going to also need to make sure that they have a PTAN in order to bill at that point if they're doing that early termination. So this is really meant to help catch maybe providers that change their mind or maybe submitted for an opt-out in error, just allowing them option. But it does hold tight to those 90 days. Next, let's look at the documents, and specifically we're going to be talking about that opt-out affidavit and the private contracts. So the opt-out affidavit is something that has specific requirements, and it needs to include the provider's name. It has to include provider information, so address, phone number, date of birth, social security number, because remember I mentioned they are going to get a record created in our PACOS system. And providers can submit these to change information. We do understand during that 2-year period, maybe an address has changed. It's that same affidavit to change that. CMS does not have a template, but Max can create one, and WPS has, and I'm going to show you that. So again, we are on the WPS GHA website. I'm just going to search opt-out. And there is a resource, and this is included in your resource section of your materials today. It's the opt-out affidavit. And this is where you can find our template. It's available for download. You don't have to use this template, provided that it includes all of the information and addresses all of the statements in the sample. These are also the statements that you will find in the Chapter 10. There is a section in the IOM that does talk about the affidavit contents. So as long as all of that is addressed, it can be something that is drafted up by the provider or the provider's attorney. It does not necessarily have to be our template. However, the template makes it a little bit easier. It's a form, you can fill it out, and we do accept it. So it does have all of the information, like I said, provider's name, their address, their phone number, date of birth, social. They're asking us if there are any PTANs issued. So we're looking for that in our template, because if the affidavit is approved, we have to make sure that we are deactivating those. We do ask if the provider wishes to order and refer. That question is asked typically because, again, we're going to need that date of birth, and it might impact if there's any additional development. If something is missing, there's some leeway when we're reviewing these that CMS allows max, but typically we try to get everything. And then if you look at the information in that, the statements are what you're agreeing to, that you understand that the opt-out period is for 2 years, that you cannot bill Medicare except for those emergency services, that you're not going to submit a claim. You're going to acknowledge that you'll be entering into private contracts, and that the beneficiary needs to be made aware that you're not going to bill Medicare, but they can't either. They're forfeiting the right to those benefits. And that information is in there. Some of those statements are stated multiple times, again, simply to make it abundantly clear to what is being agreed to in that opt-out. So this needs to be filed within 10 days of the first private contract. So it doesn't necessarily have to be in place before a private contract is entered into with a beneficiary. So there's that leeway. Like we said, the provider has 3 choices. They either bill Medicare, which means they enroll, they opt out of Medicare and they're entering into private contracts, so they're not seeing Medicare patients. If a provider sees a Medicare beneficiary and is deciding to choose the opt-out option, they have 10 days to enter that private contract, and it's 10 business days. So keep that in mind. So I just want to show you some examples. I really did show you that on the website, but you do have that also in your training materials today. I've also included that link to that affidavit. This sample is used by WPS and can be submitted for any of the WPS J5 or J8 states. So it's for those 2 jurisdictions. This is not a sample form that would work for other MAC jurisdictions, check with that MAC if you have questions about opt-out in their jurisdictions, and see if they have that same sample. They might. This is page 1. And then there is a page 2, and I didn't talk about that, but it continues required verbiage. We did go through that a little bit. It does also include the signature page, and it needs to be signed and dated. It does need to be an original, so this does need to also be mailed in. We currently don't have an electronic way of submitting these through PAYCOS, so these are something that need to be mailed into our office, and our mailing information is there at the bottom of that form. Okay, so keep that in mind. All right. Providers that are understanding what opt-out means. We've talked about that affidavit. We've talked about cancellation. So gone ahead, set up to opt out. Now we want to talk about those private contracts. So first and foremost, private contracts do need to be in writing. These aren't going to be verbal. It does need to be in writing. It does need to be presented to the beneficiary. CMS does state that the print size that it is created in does need to be an appropriate size so that the beneficiary is able to read it without difficulty, and so that we know that they can understand everything that is in there. No super fine print, if you will. It does have to include statements of financial liability. So it has to be clear to them that they will be financially liable for all services that are provided, and that claims will not be submitted to Medicare, and that the beneficiary cannot submit their claims to Medicare. So they do need to make it very clear that the beneficiary is forfeiting the coverage for those services through Medicare. And they may have a supplement that covers it. They may still be working. They may have another insurance. There's a lot of reasons why a private beneficiary would choose to forfeit those benefits and enter into a private contract, and that's a personal decision. We just need to make sure that they're very aware of it. So along with that, we have to make sure that that private contract includes opt-out effective and expiration dates so that they know what period of time we're looking at. And then it does need to be signed by the provider and by the patient or the legal representative. So both parties are agreeing to, yes, these are the terms of receiving services, okay? And it needs to be provided to them before those services are provided so that they understand and can make that choice of whether to continue. The private contract is not going to be submitted to the MAC. The provider needs to maintain that copy with the original signatures, okay? And then that has to be available if for some reason the MAC would like to see that. We may ask for it, we may not ask for it, but we do not maintain record of those private contracts. That is between the provider and the beneficiary, and so that burden is on that provider for that, maintaining that contract. And the patient also needs to get a copy of it. The copy that's maintained by the provider cannot be the only copy in existence. The patient or legal representative does need to be provided with a signed copy as well. The last thing I want to go over with you is the emergency services. So I did mention that a provider is not going to be able to be dually eligible, meaning they're not going to be enrolled and opted out at the same time. The exception to that is going to be emergency services. Emergency services can be provided without entering into that private contract because the situation is, it's just that, it's emergent. There's not time for all of that. There's just, we need to treat the patient, do what's best for the patient, and then take care of that. However, if a provider is providing those emergency services and they're not entering into the private contract, which they won't, they will need to enroll to bill for Medicare. This is the one instance where a provider who's opting out is going to fill out that CMS 855I, and they're going to enroll for Medicare. However, their PTAN that they are assigned is going to be flagged that it is for emergency services only. And it's going to edit claims and adjudicate claims based off of that. It's going to be looking for that. So, and it's for emergency services and urgent care. So keep that in mind. The other thing is when that provider is going to bill, they're going to bill using a GJ modifier to help us identify those. So all of that's going to go into that claims processing. And this would be the one time an opt-out provider is going to be eligible to bill Medicare for services. One thing before I do check in with Ellen for questions, I am providing you with some resources today. So CMS has their manage your enrollment page. It does talk about opt-out. It does have a lot of the same resources that we talked about today that are available on the CMS site. But we did go through the WPS resources that do link to those as well. I'm also including a link to the Medicare Benefit Policy Manual, Chapter 15. This is going to offer you a little bit more information about those private contracts and how opt-out impacts those and impacts the benefits the beneficiary has. And then also we talked about that program integrity manual. And then lastly, we have the WPS resources, which we did look at, except for the claims for professionals opting out of Medicare. I didn't go into that, but that's going to come into play when if you have a provider who's billing for those emergency services. There's information available if there's something to bill for that situation. Okay, with that, I am going to check in with Ellen. Ellen, do we have any questions in the chat?
Leanne, yes, we do. And this is kind of a weird situation, I think. The provider had submitted their opt-out letter, and the letter was actually dated June 30th. They submitted it the first week in July. However, when they received their opt-out approval, it stated that it was going to be effective as of June 30th. They were anticipating it would be effective October 1st. They are a participating provider. What do they do at this point?
That's interesting. And that one, unfortunately, I'd have to actually look at the record, which I cannot do. So I would recommend calling customer service. If you're a participating provider and you're enrolled in Medicare, I would agree with you. I would be seeing that October 1st effective date. And it looks like they gave you the effective date that it was probably submitted and signed. So I think I would contact customer service and have them take a look at that, and they may refer you to a provider enrollment representative. That is an unusual situation. And I wish I could answer that better for you, but without actually seeing the affidavit and the provider records that we have in PACOS, I'm not going to be able to answer that.
Okay, thanks for that response. And that's the only question that we have at this point.
All right. With that, I have a couple of conference opportunities that I'd like to share with you. First, we do have a National Provider Compliance Conference coming up on August 7th and August 8th. This is intended to be education on multiple topics for provider compliance professionals. So if you or you know of someone who may benefit from this, I encourage you to take a look at that. This is a virtual conference and it will be held from 12 p.m. to 4 p.m. Eastern on both days. And I do have a link here for the agenda and registration information. So if you'd like to take a look at that. And then we also have a National Provider Enrollment Conference that is scheduled for late August. CMS is hosting this in collaboration with Noridian Healthcare, and it is an in-person conference. There will be representation from all MACs, including WPS, and it's going to include sessions from Provider Enrollment 101 topics to sessions that are talking about upcoming regulation changes or proposed changes. So if you're interested, I encourage you to take a look at that. I have included the link that includes the agenda items and the registration times and what is offered. It's going to vary by day, so you'll want to check out that link. But it's going to be a nice opportunity to get to meet with CMS and your MACs in person. That is being held on August 28th and August 29th in San Diego. Uh, what's nice about this one, this is a free conference, so it does not cost anything for admission. Certainly travel, lodging, that is going to be on your own, but it might be something to consider. Should be a very nice conference. And Ellen, one more chance. Can I check with you to see if we have any questions in the chat?
We've not received anything else, Leanne.
All right, thank you, Ellen. So that will end the presentation for today. On behalf of myself, Ellen, and the entire WPS GHA provider outreach and education team, I'd like to thank you very much for taking time out of your day for attending today. Please take a moment to fill out that survey. We look forward to those comments, including any topics that you'd like to see in the future. So with that, I would again like to thank you. Have a great day. You may now disconnect.